All right, everyone, good morning. Thank you so much for coming and joining us today. We were just saying, it feels like we haven't had one of these in a long time, even though we only skipped last month. Because of our annual meeting, it feels like it's been a while since we've come together, so it's nice to see everybody. Nice to all be together. We are in for a really wonderful discussion today. Before we get started, I do want to give a few announcements. But first off, for those of you who don't know me, my name is Corey Stutes. I'm Community Impact Director here at United Way of Licking County. I help to plan these forums along with our planning committee. Some of those folks are here in the room today. So if you see Jamie or Kirk around, please be sure to give them a big thank you and a high five for all the work that they do. But real quick, I did just want to give some updates. Hopefully you've seen the emails, but if you have not, our next round of community impact applications will be available starting Monday. If you have not applied for those in the past, I would be happy to help you with that process. There will be an information session on Friday, the 22nd. If you didn't get that information, just grab me and I would be happy to send it to you. Make sure that you're on my mailing list. But hopefully all of you saw that. The due date for those will be June 19th. So we look forward to partnering with all of you that we are partners with. There are some, every year we refine the process a little bit. So if you are, especially if you're a new applicant, but even a returning applicant, I would encourage you to try to make it to that information session on the 22nd. Also, we have our monthly forum schedules up there. If you don't have one of those, please be sure to grab one. These do happen on the second Wednesday of every month, except for last month due to our annual meeting. And so all of our topics are planned out for the year. Grab one of those. You can register for all of those online and make sure that you're in the know about all the topics. Also, if you have certain topics that you find that you would like for us to talk about, please let me know. We are always planning for the following year, so we'd be happy to look into one of those and work one of those topics into our schedule. With that, I'm going to bring up Deb Dingus, who is our Executive Director. She's going to get us started off today. So yeah, Deb.
Thanks.
All right.
Good morning, everybody.
Morning.
Good to see all of you. So excited today to continue a conversation that's been an ongoing conversation in Licking County as we continue to work together to address homelessness and housing across the county. I am more and more convinced that we need to be looking at this issue from a regional lens while taking a local approach. Regional because our community regionally, the Central Ohio region, is continuing to grow. We're one of the fastest growing communities and regions in the country. And there's a whole bunch of information about that. United Way of Central Ohio and Morpsey were recently a part of one of our community discussions. But today we're going to take a very granular look at what is a local response system and what is a healthy local response system to better equip our community to address homelessness in Licking County. Before we dive into that and I present our presenter, just want to give you a few slides to reset, to bring you up to speed on what we've been doing and where we are in this conversation. Right before COVID started, our community was engaged in a strategic process with the goal of how do we eliminate chronic homelessness. Our community raised roughly $80,000. A task force was put together, a couple of consultants were hired, and hundreds of people participated in conversations, gave back feedback to direct this work. From that process, and we reported out on this process in the beginning of 2021, we held 36 hour-long stakeholder meetings. 366 surveys were completed, 6 community strategic planning sessions were held, 3 public input meetings were held, secondary data analysis was done, and network analysis was done by experts in the field. And 3 basic components came out of the suggested community action plan and directions from our community. Develop an affordable housing trust. Well, good for us, because regionally, a regional affordable housing trust was beginning to be put together. Our own community, through the Licking County Foundation, jumped in as a part of that regional affordable housing trust and established a fund right here to help encourage and to help with development of affordable housing options for Licking County. Check, number 1. Number 2 and number 3, a local response system, which was outlined as a part of evidence-based practices effective in addressing homelessness, was the number 2 issue. And the number 3 issue, develop a low barrier shelter, meaning give people a bed first, and then let's start working on all of the other issues. There was a lot of work, a lot of money, and a lot of attention. What we know is that the methodology and the evidence-based practices still affirm this report. Let's fast forward just a little bit. What we saw then in the fall of 2024 is that Newark and Heath passed local ordinances making it illegal to have public camping. And those that receive misdemeanors, those that are eligible, are invited now to participate in a home court process, a diversion process, once they have received the citation. And once they are cleared to participate in that diversion program, then we have folks that are partnering together to get folks immediately into some form of shelter, whether it's a hotel or a shelter. We at United Way, as well as many communities, feel that let's do something preventatively before people get arrested. Let's look at homelessness preventatively. So we held a meeting, 217 were in attendance. We asked and had discussions on 5 critical areas around everything from mass emergency housing all the way to low barrier shelters. And we announced that Licking County would be continuing in the next year or 2 to dive deeper into putting together a response system, a coordinated system. We had an intern from Denison who was able to collate the information that we gathered from this meeting. And again, 5 priorities were lifted up as suggestions. The number 1 recommendation was develop a low barrier shelter. The number 2 recommendation was organize a coordinated system. Number 3 was we need elected officials to be a part of the process. Number 4, we need more affordable housing. And 5, we need more supportive housing. Those were the 5 priorities that came out of that community discussion. From there, we then, a few months later, held right here, and you'll see Shannon up here. She was a part of this panel. We took the number 1 issue that was recommended and held a forum on what is low barrier housing and why is that important for Licking County. We had a great conversation. Dan Davies from Southwest Licking School District, myself, Stephanie Dunlap from Whole Living Recovery, and Shannon TL Isom from the Community Shelter Board were present, and thus began an even deeper relationship with the Community Shelter Board. I will say too, United Way, before even beginning to gather people together in 2018 and 19 to address homelessness, went to the best in the nation, to the Community Shelter Board, at that time, Michelle Heritage, and asked, who are the folks we need to get together? How do we begin this process? And really, that was the catalyst for this work. In addition, we had had a couple of conversations with Barbara Poppy, who is still nationally known in the world of homelessness and housing. So we had this conversation. Then in the spring, we gathered with some really important people in our community, headed up by interested community members. Whoops, excuse me. Their idea was to have a movie screening of Beyond the Bridge. Fabulous, fabulous. And the idea was to then have and generate community conversation out of this documentary. So before we held the showing, we also identified 3 dates to host 3 contiguous community conversations around this. It was held at the Midland in October of 25. We had roughly, I think, 400, I can't remember the exact number of folks register for this event. Components of the movie certainly include, homelessness is a housing issue. We need more housing. That is without a doubt. We also, though, know that people, for a variety of reasons, need permanent supportive housing. So that was a key component. But we also heard elements of the role that a coordinated system plays in keeping people from, entering into a system, exiting, entering, exiting, and why that's important for communities as well. So then from that showing, our first community conversation was about financial stability in Licking County. I'm asked daily, why aren't our levies passing? Why aren't we supporting this in our budgets? Frankly, when you look at the economic stability of Licking County and Ohio, at the end of 23, 41% of our households are struggling paycheck to paycheck. And so we had an opportunity to have some leaders in our community present. Dana Moore from the YMCA, Alyssa Shepard from the Food Pantry Network, Ashley Washburn from Family Health Services, and Trina Woods from the Licking County Coalition of Housing, looking at all the key components of a stable economic household budget. Our next community conversation, we took a deeper dive into supportive housing in Licking County. We have some great partners in the community that are running supportive housing in our community. We don't have enough. There's a lot of stigma around supportive housing, but folks, we have absolutely got to get around supporting more supportive housing for individuals who need those alternative housing models in their life. So again, a great group of leaders. Jody Hull, author from the Licking Metropolitan Housing Authority, was here. Ann Roach from Legal Aid, Celia Kendall from Beacon 360, Leah Warner from the Corporation for Supportive Housing, Trina Woods again from the Licking County Coalition of Housing were in attendance and provided great information. Our next deep dive then really sets us up for today's conversation. While we were having these conversations over the last year and a half, we also began conversations with Microsoft about grant dollars to hire either an individual or a consulting group or a contracted group or an individual to help us move forward the idea of putting together a local response system, a coordinated local response system. Then from that, our conversations began also within, again, the regional lens of we are growing. We've got to start thinking about this. There are so many areas in Licking County that we're looking regionally. When we think about mental health, when we think about now what we're doing with the Journey to 5 kindergarten readiness, when we think about transportation, when we think about what we're doing from addressing things that affect our growing aging population and healthcare. These are all areas that are thinking and working regionally. We are part of the Mid-Ohio Regional Planning Commission, and these are conversations that our whole community needs to know about. And so we took a deeper dive on how are we growing? What's the reality about this growth? And so Cameron Garzak from Grow Licking County presented. Dave Dixon from the Mid-Ohio Regional Planning Commission did a presentation. Erica Mullerin from Co-Ohio did a presentation. Shannon, again, from our Community Shelter Board, and Michael Wilkos from United Way of Central Ohio were all presenters. We announced at that event that we would then be contracting with the Community Shelter Board to work with us to put together, again, through a regional lens, but helping to put together a local response system to address homelessness in Licking County. So with that, that brings us to today. Again, in partnership with Microsoft, United Way will be working with the Community Shelter Board to create a coordinated, formal local response system to address homelessness and housing in Licking County. Again, this was the outcome of thousands of dollars, hundreds of people, lots of conversations, and evidence-based practices really indicate to us this is the way to go. This is not to say that the other efforts or current efforts and previous efforts are not needed or valuable. But what it is to say is it is time now to get a little more formal and a little more organized in our approach to address this issue. We've got a lot of great programs in our community. And all of them need more staff, they need more money, they need our support. But if we are going to continue to grow, and it's not if, I should say, as we are continuing to grow and as homelessness continues to increase in the region, we also need to be thinking preventatively. And we also need to look at the way that we're creating a more efficient response system in our community. With that, it is my pleasure, it's my honor to share just a few words about Shannon this morning. Shannon is the president and CEO of the Community Shelter Board, the third one in succession, where she leads the coordinated regional system that prevents and responds to homelessness across Columbus and Franklin County. Appointed in 2023, she oversees an $82.1 million community investment that supports a network of partner agencies providing outreach, prevention, shelter, and housing programs, all working together to make homelessness rare, brief, and non-recurring. That's important, non-recurring. Shannon brings more than 20 years of executive leadership spanning public health, not-for-profit management, medicine, and business, with deep expertise in equity and the social determinants of health. Previously, she served 9 years as the president and CEO of the YWCA of Dayton, growing its operating budget by 196% and securing the first billion or million state biennial.
I love a billion.
I love it. I know. That was subconscious. We're gonna get $1 million. Million state biennial appropriation for Ohio Council of YWCAs. She holds an MBA in Health Administration from Northeastern University and a biology degree from Spelman College. With that, will you please join me in welcoming Shannon this morning?
I have excitedly been a part of this conversation in this community for a couple of years now, so I feel that the introductions can be less and more. More about really as you've welcomed me and you as a community being facilitated about what's needed. I've been speaking to Deb at least a couple of years, and it sounds like my wonderful predecessors, Michelle Heritage came before me, Barb Poppy who came before her, both of which still in the community, still dedicated to this. This is something that never really lets you go, this human condition of homelessness and housing destabilization. That what you get in the community as you are processing, what you get in the community is then being able to utilize us literally as a resource, a living narrative of how to walk through this process for your community. So thank you for welcoming Community Shelter Board as well as me in walking through the conversation. Deb has told me that you all have been talking about this and from some of that history a long time. And so, I wanna move before us with at least, one assumption or two assumptions. The first is that I am going to speak as if for this next hour or so, I'm gonna speak as if the answer is already here. It's just a matter of how. Okay, that's my first assumption. And then my second assumption is that I am going to assume that everyone in the room understands it is important, I would say, not only important, but imperative. That every community, every business stops and pauses to look back and evaluate, assess to see if we're on the right track. The road that we're on is the right road we should be on, and that's what we're doing. So that means that I am welcoming in not only those who are proponents of what we should do, but it is imperative that we have some skeptics in the room. Because it allows us to question. Questioning is a good thing. And so those are my two assumptions that I'm going to speak with you on. I know that you all have heard a lot about the Community Shelter Board. I have a couple of my employees here with me. I will tell you that I think this concept is kind of hard to grapple with. Even as I was recruited in, I was telling someone I've been here 3 years, and it's probably taken me honestly two to really figure out what I'm supposed to be doing. Because it's hard to understand, it's hard to articulate. There's so much, as Chris is nodding, he's been with us 5 months, and I think he said to me yesterday, I think I just had another aha moment. It takes a while, so that's okay. So I'm noting that because what I would like for you all to do with me is that this is not like a didactic classroom where I'm talking to you, but that we're talking to each other. So we have a couple things that you can write down if you have a question. But if there's anything in between, please, as I'm speaking, I'd love for you to just raise your voice and interrupt. Not an interruption, but interrupt for clarification, for comment, for questioning, evaluation, assessing, to make sure that we're all together on the right road. Okay, fair? All right. I'm gonna talk about what Community Shelter Board is in just a minute to give you some framework. But one of the things I think is really concrete to talk about, and I talked to Deb about this, is we did our point in time count. And I think I asked Deb, hey, how did you guys' point in time count come out? And she's like, well, I'm not sure. It's like, okay, well, we got to know that. So why is it important to know what the point in time count is? We use it at Community Shelter Board as a volunteer. Before I came, it was more like a volunteer. First of all, it's compulsed. It is an obligation you must do. The government says so if you're taking their money. What money are you taking? HUD. So HUD dollars come through and they say, in order to take these dollars, you have many things that we're going to make sure you are required to do. One of those requirements is a point in time count. So with that point in time count, which all communities do, it is then, I believe, equally as much of a requirement that community knows what that data shows, because that data is sent to the federal government on your behalf. So you should know that. And so one of the things I want to just note to you all is when you're talking about a coordinated entry, or coordinated pathway or coordinated response, it's really, really less about the how and more about the who. Who are you accountable to? Community. Who are you responsible for? Community. What metrics are you responsible to report out to this community? And then with that, because we're using federal governmental dollars, there should be a level of, and just in general, transparency. And if any community says, I want that to look differently, you're allowed to pause and organize and say what that looks like. So I'm gonna tell you how we do it. And this has changed since I've been here, but let me tell you how we do it. we construct, we do it. We had a little over 340 people, I think, that volunteered for our point in time count. That goes up every year. Why? Not because I'm magical, which sometimes in my mind I'd like to think that I am, but it's really because we say, community, this is our community and we need your help. About 340 people came out. We do it all in January because the government says you have to. And so we do it all. Have any of you been part of that point in time count? Yeah. So we do it all in January, which means your community did it in January. Why? Because it's the coldest time of the year. And if people are outside when it's really, 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 really cold outside, then it lets you know that we have a problem here. Okay, so that's 2. 3, which I think is the most important, is it determines your strategic focus. It determines what other partners that you should have. It determines where you're doing really well. More importantly, it determines where you're not. So for us, we saw a 43% increase in unsheltered homelessness. 75% were newly reported HIV/AIDS. Over 50% reported, self-reported that they're having a mental health issue, crisis, or diagnosis. We saw a decrease in our youth. We saw a decrease in our youth who were pregnant. We saw an increase in those that experienced domestic violence. We saw a slight, maybe even maintaining our veterans, which is important to us, how we're doing there. We saw an increase in our chronic homelessness, how many times people have been in and out of our shelter and then on the land. Those data points are important. Those are important for I know because the community must hold me accountable for next year. There must be a change. And the only way that we can really do that is through collaboration, partnership, and coordinated effort, because as one entity, it is impossible to do all those things. So I'm noting that first as we move through the discussion, because I think this is concrete and this is clear. I think it could tell you a North Star that if you have any increases in anyone that is on the land, it allows you and all of your partners to know where your money should be spent when you come here next year, what you're accountable for, what should be the strategic plan, what should be the programs, and more importantly, what it helps us do when we ask HUD for more money is we're going to ask for more money in those areas, at least within our community, that the changes have been marked. Okay. I will leave this so that people can look at it and I don't, okay, let me get this to you. All right. Okay, questions so far, are we good? Yeah.
So would we be able to get a copy of that? It's online, so if you go to our website, csb.org, it should be in the front header, or it can be csb.org/PIT, PIT, and you can download or view the electronic copy of it.
Question and statement. I've done point count time here. And for the 3 times I did it, I had counted 1 person. They sent me out to farmlands where we know for sure that no one lives. And I'm furious. My hair's standing up.
Right now, is it standing up right now?
Furious.
Yeah,
Yeah.
yeah.
It's like go out over here when we know someone is not under the bridge because it is freezing out by the water. It's like, why are we going by this school when we know that they're not there? Why don't you? I mean, it seems like it's like go out here to fail and then so we can undercount. That's what I feel. So, and it's just, I just can't do it anymore because it's like, I feel like I've been, it's a fake fraud. What, you know, it's upsetting to me, man.
Yeah, let me position that a little differently. I wonder if when your community says, let's do a more coordinated effort maybe with this, that what you all can do as you prepare for the point in time count, we prepare for it for about 6 to 7 months. That what we can do is determine teams that not only will go to make sure there's no one, that's a good thing. No, it is good to know that there are some spaces where there's no one and you're verifying that. and to ensure that there are spaces we're going to see if there's someone. But that is done in a coordinated way, and we didn't get there. We're there today, but I'm the third CEO. We've been working on this a long time. And I think it's important not to believe or think with energy that if next year are going to be perfect, or the year after you'll be perfect, but instead that this is a course, a continuum, that you will learn more to be better next year. But it is really good to know where people are not. And as you take in that data point, it allows you then to narrow and say, well, we can go there for maybe a second, but let's figure out other places to go. This year, I'll tell you this, that because we had 340 people, last year we had 250 or so. Because we just had more people, we found areas where unsheltered homeless, that we didn't know. And in a lot of ways, we had folks, activists in our community, saying, how could you not know that? That is upsetting. This is the work you do. And that's holding me accountable, as they should. But there's something about having more people that just helps the process. And so we have to understand that in this space that we're all trying to figure out, that is growing bigger than how the pace in which we can keep up, that there just has to be a little room to figure it out. So I would say that I think that is, and let me tell you, don't lose good anger. I'm mad. I love that. That's good. That's energy, right? And it holds accountability. But I don't want it also to be lost in the anger. That somehow that what you saw when you didn't see anything was not a data point. It's good to know that. In equal measure, though, I think what you're holding account is that as I know that someone's not here, then where are they? Good conversation. And then how do we map that out so that next year we will have, even if it's a tentative map, a draft mapping of what we know from the years prior. And that just helps. So next year, with all the resources that we have and 350 people, I am smarter than I was last year. It's just the way that it goes, right? What we can't do, and I'm telling you as someone who's standing before you, but what you can't do is be so upset that it disengages you. We don't want disengagement. And I'm telling you as someone we know that this is a tough job. It takes a lot of energy, emotional energy. So thank you for the question. I think we can build on that. Draft mapping. Any other questions? Thoughts? Anger? Any other anger in the room? Okay. All right, we're good. Okay, so let's talk a little bit about community shelter board. And again, I'm going to go through this pretty quickly, not because really this isn't what you're doing, but it gives you a framework of what we're thinking about, is how did Deb keep saying, how do we have a collective response? I wrote it down that over and over and over again, this community has landed on that you need a local response system. Landed on that over and over again. You need to develop low barrier shelters. You need elected officials to be a part of it. You need deeply affordable housing, and you need supportive housing. I would tell you, for all of those things, our county, if you would have switched me out with Deb and I was sitting in front of my community, I would say the exact same thing. No different. We've been working on this 40 years in June. I would say the exact same thing. So I'm going to note that, because the North Stars that you're working on it, not that you have all the answers and it's going to fix it just like that. It just isn't. So community shelter board, what has been really great about this is I've come into the community, what is really great is that everyone knows that we are the system leader, and that just makes the job easier. So if you're thinking about a local response system, as I've talked to Deb, who's the system leader? Who's leading? And who do we all say that person's leading? That means that not only do they have voice to speak on your behalf, but they take all the arrows. Okay, I want to make sure I'm clear. They take all the arrows. 2, All right, and then, that makes for us, not only are we the convener, which I will tell you, and I'm gonna be real transparent here, because I think the education is that you need to know the good, the bad, and the ugly. Is that we haven't done really well in our past 40 years of being the convener. At points, we've done excellently, at other points, not so well. Why? Because when you are the convener, it introduces some energy that's hard, accountability questions that are tough. And at times, we've moved away from that. The system and the way that we've been funded through our electeds have sometimes been flat, not enough money, and our partners have been mad. And so what that has made us do at times is disengage a little bit to protect maybe ourselves. But if you are the system leader, you must sit there, right? Stand there leading in that. We're the strategist. And I talked to you a little bit about that, but that point in time count, we were doing it as a, I think this gentleman said it, we were doing it as a pointing to how we are numbering people. But what we weren't doing is looking at the people to help us narrate the strategy. We were looking at it as a count. It's not a count. It is a count, but it's not a count. It is a reflection of your community. And so if it's a reflection, then the strategy must come out. The mirror, right, shows you what needs to be fixed, what gets to stay. So we use our count as, you heard me earlier, a living narrative. It's a data point. Then we believe this is who we are, a regional catalyst. Well, I'm not sure if that's where you all want to be, but just telling you in our 40 years, I believe that's where we are, because we have communities like you who are changing in Ohio and don't know how to do the change, literally. And there's not a lot of data to tell you how to do it. So let me give you another peer community that is changing like yours, Butler County. And they've come to talk to us. Fairfield County, they've come to talk to us. How do they get to us? Well, they call HUD and they say, and then they say, we got someone up the street, talk to them. So we do. And so how do we build in, as a system leader, how do we build in collaborative, a toolkit to help counties in Ohio who are moving from rural to diversity between rural and urban, and it is important as for their mission to keep their rural. Well, how do you do that? Is it possible to do both? And more importantly, which I love this conversation, is if you don't decide that you're going to do it, will someone else do it for you? Which you can't have. I told Deb all that the striving and the struggling with the conversation is in itself gives you space to have voice and agency about your community. That is good. That's good. People coming in and deciding what they're going to do in your community, and I'm being a little black and white about this, should make anyone pause. Anyone. So I believe this is what's happening. And so how do we do that better? And then why do I show up every time? Because it just helps. It just helps me figure out when I go to HUD what I need to ask for. That if we have, which many counties do, we have it. If you have parts of the county that are porous, which we do, we have about 15% of folks that show up in the shelter that aren't from our county, and probably vice versa. Right? That's a normal number. Let me tell you what I've heard when I first came. We are spending, and I know you all have probably heard this before, but this is in my county. We are spending all this money on our shelters, and it's not even for people in Franklin County. Well, here's what's so great. We get to look at the numbers. And that just doesn't show that. So I get to sit with my stakeholders and get to say, well, that's just not true. There are people. And if there's a 15% reciprocity, amen, because it's probably domestic violence. It's probably a need to get to a family member. and the resources, because let me tell you something about human beings. They don't want to leave their family, community, and where they've grown up usually. It's usually forced upon them. So it stays between 15 to 17%, and it's been that way for years. That trend has not moved. You should know your trend numbers, right? So this is a conversation of how do we do this? I'm using your words locally with the response system that we know our numbers. Okay, alignment, that's obvious. I keep talking to you about accountability. Why is accountability important? Because it drives measurable impact. Impact gets to be defined by the community. And then we're a UFA, a United Funding Agency. I hadn't heard of this word at all when I interviewed for the job. The board didn't use it much, and our staff didn't use it much. And so when I heard it, when I first came, about 3 months in or so, and I was like, well, what is that? I don't understand what that is. And I came from Montgomery County, Dayton. And so I didn't recognize that. And it took me a while to figure that out, probably a good year. And I said, we got to put this everywhere. Because what this is by HUD standard, the best practice of a local response. Best practice of a local response. I think you've heard me say this. We were the first to do this. And this was driven, I'm just putting it out there. This was driven by not government, not community members. This was driven by the business community that said we need to see something different than what we have today. Okay. HUD came and studied us and called it a UFA. And what it is ultimately is that we fund so that resources, we are in charge of making sure that our federal resources, HUD, the grant, the compliance, the contracting, all the dollars that we bring in for the county, then get spread out throughout the community. We are charged with, because all homeless and housing strategy is owned by the county, including yours. So we are in charge with making sure that as a proxy for the county, we are in alignment with them. Then we go to the state and ask for money. I will tell you again, good, bad, and ugly. I'm from Franklin County. The state doesn't look like the way that we think, and so we don't get tons of money from the state, but we're working on that. And then local, which is city and municipalities within the county. And we take all those dollars together, we put them together in one place, and then we strategize about how they move out. And then we ask those partners, those programs to be accountable for best practice. We look at those numbers monthly, report them out quarterly, report them out to our board, the partners boards, our external stakeholders, the community members. And then we combine them again 6 months later to start competing for HUD dollars all over again. And what we have found in that process is that year over year, do you know who our number one funder is? HUD. And I would tell you, as I've told the board, that if we went away, Community Shelter Board, this local response system, if we went away, it's possible that we can. If we went away, then what would go away with it is the philanthropic coordination, compliance, and response, the agility to respond fast. By the way, many communities live just like that. Nothing wrong with it. It just is. So what we're talking about is making this community system faster, more agile, more importantly, that you drive in more dollars, which is always my favorite part of the conversation, driving in more dollars. Okay, heard about accountability, collaboration, and then we do strategy. Here are the other UFAs. I told you best practice. HUD came and studied us. They called it a UFA. That was back in 1994, 1992, 94. And then they offered other counties and continuums to be able to do that. And as you see, there's 15. 2 in Ohio, which is pretty interesting.
You had said that the Unified Funding Agency was kind of leveraged or brought into existence by virtue of a relationship with the business community.
Yes, yeah.
And does
Yeah.
this go towards accountability or
Yeah,
structure or?
yeah, that's a great question. So, and I see, is that a Rotary shirt?
Yes, ma'am.
Yes, yes.
Yes, ma'am.
I'm all Rotarians, okay. Yeah, that is, let me tell you, I appreciate the question, because I try to press in a little bit in our community to remind of the history. It is really, really easy for us to put the responsibilities of when the gap, right, when the two ends don't meet, that gap on nonprofits, and in fact, that's what nonprofits are there for, right? They are our philanthropists, they are our benevolence of our community, but when those two ends don't meet for a very long time, then we should have collective dollars step in, because there's a problem there. So, 40 years ago, when philanthropy looked different in general, that we had, you all know them, the Schottensteins, who own Value City, the Lazaruses that were in the community, as well as Jeffries, which was manufacturing, got together, the business community, and said, we should not have, with as resourced as our community is, we should not see homelessness at all in our community. And so how do we, instead of all the nonprofits coming to us individually, how do we put our philanthropic dollars together? Ask our public dollars to figure out how to do this housing strategy and this homeless strategy. And then figure out how do we do this in a way that is efficient, great quality, and excellent outcomes. And with that, that was spawned and catalyzed by the business community. Then our public officials, our elected public officials responded. They created this entity, this proxy called, at the time it wasn't CSB, but was us. Why was it outside of the county? Because the county from the federal government is responsible. You can't get around it. We have 88 counties here. You are responsible for housing and homelessness. It's everywhere across this country, and HUD talks to the county. HUD does not, or the federal government does not talk to municipalities, doesn't talk to cities, doesn't talk to townships. They talk to the county. So our elected officials, catalyzed by those business folks, said, okay, well, let's create this, because we can't take private dollars. The government cannot take philanthropic dollars. So then this entity or proxy called Community Shelter Board was made. And the collective portion of it, if you see the resources, that meant that those private dollars could be then put into this entity with those public dollars, and they catalyze for one strategy. And then it also allowed us to go to the state. It also allowed us to go to other parts of the federal government and ask for dollars. It allowed, because we pushed those dollars out for the nonprofits to say, well, you're missing this, you're missing that, we need money for this. And so when HUD came and studied it, and how did they know to study us? Because when we applied for money for the federal government, we did it as a local collective response system. They didn't get a whole bunch of different grants, they just got one. And they came and studied us and called us a UFA. And from there, they offer it, and those are the continuums of care across the country who are considered that.
Excellent. Thank you.
Okay. All right. Okay, so how do we do it? This might be the good part here. Can everyone see that? These are our partners. There's 16 of them. Now that I've been here for 3 years, and I felt like this probably about 1.5 years in, it's not enough to do the work of our community. I think we're about 8 to 10 down on what we need to really do the impact work. But it's a good showing. What you can or can't see, I'm not sure, is you'll see words like who does our transitional housing, who does our diversion and coordinated entry, who does our rapid rehousing, who does our street outreach. Choices is our domestic violence beds, which were not under our system, but as of this year are. who does our shelters. We have 9 emergency shelters, and who does our supportive housing. So when you have, even as of 10 years ago, $35 million, 10 years ago, we had 35 million. Now the community has 65, when we leverage the delta of about 81. That those nonprofits would then apply for those dollars and say, we will do this. And then we put those dollars out into the community based on their application. And if something pops up, so let me tell you what we don't have on there that you should see very quickly. You should say, hey, who are your youth? I mean, you see the programs, but who does your youth? Don't have it. It's a gap, it's a problem. As our seniors are, and we call seniors 62 and over, where are they in that? They're there, but it's not specialized. That's a gap for us. That's a problem. We have proximal systems, Adam H, mental health. I think, why am I saying that? Is because sometimes we think everything in homelessness, everything that shows up in the human condition is also able to be taken care of in the shelter. It cannot. It cannot. So mental health should be a partner. We have them as a partner, but we need to be stronger. We talked about yesterday, I get this question a lot. Well, if you put them into a house, they need to work. Get that a lot. Sure. But it's hard for the homelessness system to also do workforce. They're just different things. Right? So when I was looking to make a jump for my job, I went to someone who knew how to really help me get a job. Different than my realtor. I wouldn't use one for the other. You understand, right? And so what it does allow you when you have a local response system is to really curate and calibrate. Gives you time and moments to really start thinking about what your community needs versus what case managers aren't doing. Okay, makes sense? Thoughts, questions on this? I'll keep going until you guys stop me. So homelessness is fundamentally a housing issue. So I'm gonna pause on this because my community too, we struggle with this. I asked this question, why do we think we see so much increasing of homelessness? I get a lot of answers. You all have heard me say this, but the number one answer is we don't have enough housing. Just don't have enough. And we could say, but we have plenty of housing. Well, housing has to be affordable and not affordable only for those who we think can afford it. It has to be affordable for everyone so that everyone can afford it. That's the difference. If it's affordability, then there's a problem with housing. It's a basic need. It is a basic need. It is a basic need. It's a basic need. And you're going to spend the money somewhere. I have $81 million that I spend in a housing and a shelter system, and I am telling you all, as being a good steward of dollars, that is becoming too much money. It's too much. It is unsustainable at some point. What is sustainable is a good housing response system. If I add one more shelter bed, you know what that gets me? A bigger shelter. Gives me a bigger shelter. And so where is these are the things I'm struggling with. Nine emergency shelters. Do we have enough for that community? Yes. Are they all full? Yes. Do we have a waiting list? Yes. About how many people are on my waiting list? About 300 at all times. So at this point, it becomes, and I get this question a lot, do you add another shelter? We could. But I would say the money, right, because of my local response, the way I'm thinking strategically, the way that our numbers are going, that we don't need to add more shelters, we need to add more housing. And how do I do that? Deeply affordable, okay? So you'll see that as part of the issue here. Okay, any thoughts on this? Any counter thoughts on this? For your community? Are you saying, yeah, that's Franklin County, but this community, I want to know this is a driver of homelessness, or this is a driver of homelessness. Yeah, please.
I've heard in some spaces that churches are reusing as they close, are reusing their facilities as affordable housing opportunities. Have you seen that in Franklin County? Is it working?
Yeah, we at the state level, there's something called, what's it called?
The promised land.
The Promised Land, thank you, with Senator Michelle Reynolds. Yeah, we are seeing, and I think appropriately so. Just like the question was behind a business community. I think there must be certain drivers of things when there's gaps for the human condition. The business community has a big voice. But so do those people of faith. And it requires us to look at things with maybe resources because the business community and economic development opportunity, but those within the faith community, it requires us to show up with giving people dignity. And so what we're pushing, what we've been talking about, it is something that is across this country, is where are the churches? And also, what is a gem around the churches is they get to say things that maybe some of us don't get to say. You love that. Secondly, they get bequeathed land and housing and gifts that could be used for community serving. Third, they're supposed to be apolitical. And so it doesn't allow you to have to tussle with what we have to tussle with, what you all maybe even have to tussle with, which is that political backdrop that somehow is housing and the maybe penalizing of homelessness, and what politics do you stand? Churches get to be out of that fray. So yeah, we are encouraging our community, and we are seeing this across the entire country, that churches are becoming bigger voices in this. And I will tell you that the solve is great, because they are able to take care of folks, marginalized people that most folks don't think about. So I'm gonna say something here that's a little tough. Where we're seeing an increase, we haven't seen this in all of our numbers. What we're seeing an increase is in those who are have any type of penalization in the judicial system around sexual behavior. Tier 1, Tier 2, Tier 3 offenders. We saw an increase of a little over 40% this winter. Oh, we have not, it was a stark increase. Like, what? Get local response, you get to look at the numbers. Like, what happened? What's going on? And what we found is that all of those dollars dried up federally. So they couldn't flow through the state. They couldn't flow through the county. And so now we have, and none of us want this. We have sex offenders that have nowhere to go. And they end up showing up in our shelters. Here's what we make sure we want to do, because we get to look at the numbers. We want to make sure that all families are safe. And we have children in our shelters. We have women in our shelters. We have youth in our shelters. And so this must at times not be about political issues. This has to be about the safety of the community. By the way, the safety of our community members too. We want them to be safe. Having the stress of not having housing is a way to make people feel unsafe. It's not good, right? So those are some of the things in which, from a church community, they would be able to, and we do have that, to be able to offer resources very differently than if it was a nonprofit, if it was someone taking funding from the local, the state government. Makes it easier. So how you use, great question, how you use your business community, if you all know, how you use your business community's voice and how you use your faith-based voice is really important to your overall strategy. I hope you all hear too that means you got to know your numbers. Okay. Yeah.
I have a question. I wonder if there are commissioners are represented here or our city, any of our communities. Are they here? Anybody know?
Local government.
No. I see a lot of nonprofits.
Yeah.
Thank goodness.
Yeah, those not-for-profits, they know how to show up. They do. Okay, I love that as a call out too, right? A to-do action item. how do we get our local electeds involved? And our local electeds are all the local electeds, school board, it's everywhere. How do we get them involved? How do we get them in the room? How do we get them to themselves sponsor roundtables around this? Okay, moving still through, feel like you guys good? Do you want me to go faster? Are we good? Well, we're good, okay. How the system works, we've talked a little bit about this, so I don't have to hit this, but I want you to be very, 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 very clear what we really are talking about, how to not make, there's a finite amount of money in all communities. So this is really what we do, is figuring out how do we go outside of our community to bring dollars in to amplify those dollars that are already in the community. Fighting over the finite amount of dollars, not useful, wrong conversation. Instead, how do we have data points? How do we have the narrative to make sure that if there is a foundation, a funder, federal or state, where dollars can pour into this community. And I am telling you, Licking County, as a rural community that is moving through economic growth, there is much, much, much more out there. Much more than what Franklin County can get. Then how do you organize to get that? And then how do we push it down to housing providers and nonprofits for community outcomes? So we're talking about coordination. Coordination is key. Coordination is key because, as you'll see here, we number one do funding, we do dollars, we align it to strategy for accountability, we monitor our overall system, and in the monitoring of our system, we perform. Now, I would tell you I sat on those numbers of the point in time count for a couple of weeks before I released them, because I was just like, okay, my goodness, all that we've done. And our unsheltered homelessness has gone up by 43%. Right? But I know the numbers. And it allows me to say, okay, do I have the right partnerships? Are my nonprofits doing the right programs for today? Or are we still funding things that 10 years ago worked for a community that no longer responds in the same way? Am I hitting my right government sectors? Our system includes all of those things, so you'll see it, and that continues. What have we added since I've been here? We have an unsheltered homeless strategy. Why? Because when we did the predictive modeling, it said that we were going to increase our unsheltered homelessness in Franklin County by 68% by 2028, and we are on track to do that. Unfortunately. So we added more street outreach, and we are continuing over and over again to renew our strategy. One system, shared responsibility, you can read that. I've already noted that. Our goal is to ensure homelessness is rare. You're going to always have it. If you're going to have it, it needs to be brief. Our average length of stay is now 111 days in our shelter system. 5 years ago, it was 23. And that is non-reoccurring. Our chronic homelessness has increased. We need this for you all. What does your healthy community look like? What are every single solitary steps in your community to ensure that not only this archetype that we have of homelessness can be healthy here, but that the young can come here? It's important. We want grandbabies to be running around, don't we? I do. Maybe that's, and I want them to be close. So can they afford to be here? Can they afford to raise a family here? Is the economic development around housing and the economic strength able to do that here? And if not, where is your gap? You all know this. I don't know if you have it or not, but you all would know it. Do you have all of these steps within your community? For us, we actually just, we remodeled this from, we took it, I think, from Pittsburgh or Minneapolis, I can't remember. But HUD says that these are all the things that you see in a healthy community. So even HUD says, okay, you will have homelessness, but it shouldn't be growing. It should be rare. It should be brief. You should have deeply affordable housing. What does that look like? that means, this is gonna get real busy. But that means if someone is making, at least in my community, if someone is making, $40,000. $21,000, $40,000, they should have a nice place to live. For my community, I don't think we have the X's on here, but I don't have anyone anymore doing deeply affordable housing, and my community housing is gone. So that means that all of those people that are making that amount of money, $21,000, $36,000, $40,000, up to about $57,000, if you're making that within my community, the leap to get to my market rate housing is tough, and more than likely, you're gonna be stuck between transitional housing or you're in my shelter. 40% of people in my shelter go to job, go to work every day. Don't have enough housing in that gap. And so it is not because folks are not pulling themselves up and doing. Some of it is, but not all of it. And so what I want us to do as a shelter is take care of the people who struggle. What we shouldn't do is take care of the people who don't have housing. Literally, just don't have housing. That's not what shelters are made to do. I will also tell you, the more people that are on my bench, and you heard me, 43% of increase, the longer you stay on my bench, the harder it is to get you housed, and the more money it takes to get you housed. Well, how much more money, Shannon? Well, in 2019, my shelter bed cost my community $9,900. In 2024, it cost my community $24,700. That's how long and how much.
Is that for?
That's what I asked the
Per day or
community to subsidize for my shelter beds, because it is harder to get people out of my bed. I went from 20 days to 111 days. And then because it's taking so long, by the time I get them into housing, I have to wrap around services to ensure that they stay. Because what happens when you're in a shelter that is with a whole bunch of people? Well, you lose how to take care of and be a homeowner, be a renter and be an owner. You lose it. Listen, I say this all the time. You know, I have a little bit about the medicine. In medical school, they'll teach you that 1 in 4 of you, they say this, 1 in 4 of you, 3 in 4 of you have some type of mental illness that's undiagnosed. That's what they say when you go into medical school, right? And we're all looking at them like, no, we are very frightened. Right? And then by the end of your 4 years, that 1 in 4 of you will be on medicine, and 2 out of 4 of you, it will express itself because of the stress. So I'm noting that because if you were spending 100+ days, for some of my families, over my big families, a year and a half in a shelter system, that's not kind, by the way. You think mental health is not going to express itself? If you were on the street, you think mental health won't show up? Okay. The only reason why some of us don't have, and depending on who you ask in my family, they might say, yeah, she's crazy, but it's because I have people around me and I'm stable. Right? So this conversation gives you all the numbers, but what the conversation also really gives you is it allows you to grapple with what's going on in your community. And it's growing and it's changing. And we should have a visual to say what that looks like. Okay. We talked a little bit about it again. I want you just to concentrate on the purpose of this local coordination tracking system. You got all that. It makes you competitive and makes you move down dollars faster. You all are right now under the balance of state, and the balance of state is great. It's great. We're all continuum of cares, which is under HUD standard, mandatory, required. Remember I said that in the beginning. So what we're talking about, what you all are talking about, what you're considering, which is always good to consider, is should you be your own continuum of care versus under the balance of state? Here's what's so wonderful about this conversation is that you're all continuum of cares. You're not extricating yourself from the continuum of care system, obligation, and requirement. What it does give you, but also you lose some things. What it does give you is a little bit more agency to calibrate your needs for this community. Remember, we said leader. What it also gets you is that you have to be accountable to make yourself competitive to apply for federal. Okay, so you'll see the difference in those two. I'm not going to read it for you. Any questions or thoughts, reactions? You all did a Licking County plan. At the time, you guys did a Licking County plan. And before we do our breakout session, I want to say that the plan, and I've read most of it, not all of it, is exceptional, but it was in 2020. And I believe what I heard is that there's been some change since 2020 in this community that maybe need to be considered. But as I read through the plan, it still felt very contemporary for the needs that you all have. They came in and said, these are the comprehensive strategies to combat homelessness. And all of those things, preventing homelessness, prevention, safe and affordable housing, which is deeply affordable housing. That means people that are making zero. That means people that are making on fixed income, $1,000, $1,500, that there should be housing for that. That means young people who are coming out of school that are being certified. There should be permanent supportive housing and case management. Why? Because mental health is in every community and they need to also have stability. Substance use disorder and mental health treatment, you should have that. Why? All communities have that. Why? Because human beings are there. Creating a coordinated system, funding, knowing exactly where all your sources are, and community engagement and advocacy. Community engagement and advocacy is this: when you know your numbers, you get to have voice and agency to calibrate the resources on what you need for the community to prevent and to build, and then what needs to be sustained. Advocacy comes. When I came, we didn't have a government affairs person. We now do, and that government affairs person, we didn't have it before. I certainly didn't have it in 2020. We have a lobbyist federally. We have a lobbyist at the state, and we have a lobbyist locally. Is that what you need? No. But is that what we need for today that we didn't have even 5, 6 years ago? Yes. Right. So it allows you to be agile and calibrate. Okay, so we would like to do a couple of minutes or more than a couple of minutes, right? Where you are asking the question, first steps, what's next? How do we move towards?
What we're gonna do is give you just a moment. First of all, on your table, there are some slips of paper, and we like to do this in our community partner council forums. If you have a question that you'd like to ask us, what we'd like for you to focus on from your perspective. Well, what do you think that next step ought to be to develop a local coordinated response system to address homelessness in Licking County? What ought we to be doing as a community, entire Licking County system? And as you're doing that, I want to spend just a minute saying a few words about all this wonderful information Shannon just shared, put a little bit more context. While we were doing a strategy and we hired consultants and tens of thousands of dollars were spent, Morpsey was also doing a strategy to address housing in the region. We had an expert come in. She had just come in to do some of the sessions. She was from California. And this was 2020. And she said, if you don't do XYZ, Central Ohio region, you're going to look like the unsheltered homeless population that I just left in California. So as Shannon said, we did a strategy. Best evidences, methodology still proves out, but what has changed? What is the layer? Well, intel. The announcement and intel is what really pushed this necessity to get really serious about the growth of Licking County. We anticipated growing in Licking County in 2019 and 2020. But once we got that announcement, we're going to be the Silicon Heartland in Ohio, and we see the data centers and we see the growth and we see the fighting in every city and village council across Licking County. Not only did we move from, oh my gosh, this is an issue, but we entered a fire of growth. That's what happened. Layer that on top of the information that we did the hard work on, not only that we did, but Morpsey did when looking at the growth of our community. Funding. In the last 10 years, we've been seeing some of these numbers. When we look at not only the HUD dollars, but we look at the philanthropic sector to Licking County, and we coordinated these dollars. We know that the foundation in 10 years contributed I think it was 312, don't hold me to the exact number, $1 million in the last 10 years. United Way, 4 million, close to $4.5 million. The city of Newark, $1.2 million, roughly almost $11 million. And then another funding stream, emergency food and shelter protection dollars. We kept funding and funding the same programs, the same things, but still seeing the numbers go up. So at some point, we all said, as our business community said, in fact, we have businesses in Licking County who are directing their funding to Franklin County. Show us a coordinated plan. Show us how our dollars are being used efficiently. Show us how everybody is working together and that the key players are at the table. Those were some of the conversations we heard from the business community over and over again. We think there are more dollars there. We heard this when we went through the strategy process. But to keep throwing dollars and dollars and dollars and not showing the aggregation of those dollars and a regular set of data is not tenable for most business organizations. They don't run their businesses that way. What we also know is that we just regularly don't get our funders together to say, who are you funding? Who are you funding? What are you doing? What are you doing? So we're on the same direction. We may have the funding right here to make significant changes, but if we all don't get on the same page and coordinate, well, then we're just, robbing Peter to pay Paul. I sit on the board for Philanthropy Ohio. I'm the board president right now for Ohio United Way. And what I can tell you is philanthropic dollars are dwindling. And philanthropy cannot fill the growing gaps that are occurring. Our federal and our state dollars are changing and dwindling as we see funding streams that we have counted on for years being thrown up. And as we see basic needs being threatened with, SNAP, WIC, housing, we could go on. So all of these things, the Community Shelter Board they've been in these conversations. They're saying the right things. You just heard them from Shannon. We are just now getting around to some of these conversations and realizing that we've got to put together some of the systems in place. The other thing that dawned on me, as the person who also has been hosting the last 5-6 years of warming shelters, is that our numbers of our unsheltered people who are vulnerable in our elements is continuing to grow. It's continuing to, I see it. I've seen it right with my own eyes. So I don't know how else I can count that, but we know that it's continuing to grow and our point in time count is not adequately addressing. However, it's an opportunity, as Shannon says, in a positive way to say, what is the disconnect here? I'm seeing this, but our numbers are showing this. I can tell you there's disconnects all over the place in the way we're addressing this collective issue. Affordability. Columbus and Franklin County is experiencing more unsheltered people and they're staying longer in shelters Why? This is our United Way Alice thing. People are struggling. There are more people struggling every single day. Am I gonna stay in my house? Am I gonna eat? Am I gonna pay for healthcare? What am I gonna do for childcare, transportation, just in general? The numbers prove it out. The trends show it. More and more people are struggling paycheck to paycheck to paycheck. And those long relied upon charity systems that could cover those people struggling are struggling themselves. Coming out of COVID, 28% of our not-for-profits in Ohio struggled, most of them shuttering their doors. Almost 70% of our not-for-profits in Licking County don't even offer their employees health care. So the whole system is struggling affordability. I don't have a big enough hat to address all of that from a national, state, local level. But there's a disconnect between those who have resources and more people who don't. That's a fact. So hopefully you've written down a few questions while I just shared a few anecdotal comments to what Shannon shared, and we're going to get to that. I'm going to go around with Corey, maybe will help us collect our questions.
Questions.
Raise your hands if you've got a question. I suggest.
You're all gonna take.
Thank you. So we're gonna answer just a few questions, and I think then you're going to do some.
Yeah.
All right, we are flexible.
Yeah.
So I hope I can read some of these. Couple of questions. Where are the elected officials in this process? They have been invited. They've been invited. I can't answer the second part of that question or.
May I ask,
Yeah.
are there any action items that this room wants to commit to in ensuring that elected officials become part of the process? What are we missing? Invite is not the right action, right? That's okay. Being again, very transparent, when I was recruited, the number one thing that the board asked me to do is concentrate on the public officials. One of our commissioners hadn't met with Community Shelter Board for over 7 years. So that's not as far reaching as we think of how do we get our elected officials engaged.
Did you do it?
Well, listen, depending on who's asking, yes, but no, I mean, it's a struggle. Yeah, they meet with me, they don't not meet with me. But for the goal I had very specifically, that I wanted them to be hand in hand, arm in arm with every part of our strategy. I haven't gotten there quite yet, right? So, but my job, as I'm pushing you all, as we're talking about what action item can we commit to, and I don't mind if anyone wants to write it down either, what action item can we commit to ensure that elected, just one, it makes all the difference, will be a part of this conversation.
Well, I think related to that, why do they not want to be involved?
Yeah, that's a good
Why?
question.
Why?
Does anyone have any thought? Why don't the elected
Why?
officials, why do the elected officials not want to be involved? Does anyone have any thoughts on that?
Well, when we did our town hall meeting, and I believe you spoke, I believe we had local government officials in attendance. There were county commissioners there. Now, what we did after that, I'm not sure, but isn't that correct? But we were at the DoubleTree, and we had that town hall meeting a couple ticks back. I noticed there were city council people there, like Spencer, Mark was there. What happened after that?
Yeah. We had city people. We did not have a county
So,
representative. That's a good question, and it's very, I don't have the answer to why
And the
they
county
would
came to the
continue to
movie.
be involved. What,
I wanna say county came to the movie, I wanna,
Timba?
yes, both had it and stuff, so. We kind of, we're hanging, we're close, maybe, you know, we just need to get a bigger hook and a longer line.
Right, right.
Something more, not suck man, that's.
Yeah. I'm gonna put the positive and assume that everybody's busy. Everybody's got a lot of things on their plate. And for a rural county, sometimes these issues, you know, you've got all these things to think about, roads and infrastructure and sewers and zoning and budgets and all of those things, that this just hasn't risen to the level of, you know, prior, like all of us, all of our business, you know, our calendars get full. That could be, you know, one of the reasons. However, another reason then we want to do this is because our community wants somebody to wake up every single day and asks the question, how are we doing, Licking County, addressing homelessness and housing? It's got to fall somewhere. It's got to fall somewhere. We only have so much capacity every single day when we wake up, and so could we have, you know, formal organization whose role it is with somebody who perhaps is paid to wake up every single day? How are we doing, Licking County, and moving the needle on homelessness?
Well, and I can say for myself, you know, I'm president of a local Rotary Club, and I've got a couple honorary mayors on here. I could do a much better job of reaching out to them and trying to get them to come to events like this. And so, you know, all of us probably have contacts with government officials and people who have relationships, even if they're just golf buddies or whatever, and you portray your commitment to it and your deep belief in it, and the importance of this for the community, it makes it easier for them hopefully to maybe come and join and be a part of it. Because they're, as you said, their dance card's pretty darn full.
What's your name?
Kirk Homer.
All right, so Mr. Kirk Homer has already volunteered. I heard it. That's one of the action items, is that when we have something like this again, we're going to have a intentional way of inviting. And if any nonprofits are in here who have an advocacy strategy, please put that on also as your activity. I'm gonna offer this body that, number two, that one of your action items could easily be that out of this, there's a call to action for a communication or an advocacy committee. And nonprofits, if you're in the room and you already are doing this, I promise you there's not one of you, not one nonprofit whose mission doesn't touch housing. Not one. So if you already have this as part of someone's role, maybe then they could also then be a part of the Licking County Steering Committee. And then third, you have to communicate ad nauseum. Truly. I mean, we send communications out. I mean, Neil's in my ear constantly. I need a break. No breaks. You gotta keep talking. You gotta keep talking. And so that could come out of also that advocacy committee. But why don't we just commit that, you know, next time we meet, we will have, and it doesn't take many, 2 to 3 people, 2 to 3 nonprofits that have a representative to say that we are going to coordinate our efforts of communicating once a month, once every 6 weeks, the same thing over and over and over again. We all need about 7 to 10 times to hear things. We all do. Okay.
Yeah.
I think there was another question and then question or thoughts over here too.
I thought there was a housing meeting like a month ago. There was something that was put on regarding housing and homelessness in this community around a month ago.
We did one, at the DoubleTree. There was an announcement from the foundation that they're gonna be funding 5 navigators and doing an awareness campaign.
Did any of the local officials attend that event?
Yeah, well, so, I don't know, I can't be honest. I think so. Yes, I think I remember seeing some of the city officials that, yeah.
So
on council.
maybe we can find out how they got them in the room, or
Mhm.
how they came to the room for that, but not this.
Mhm.
What's the difference?
Could be timing of the day, yeah.
My other question, I've got a few on there.
Yeah.
Are there housing providers here today? People who are dealing with housing and homeless?
Who's a housing provider in here today? We got a few.
That's a good question.
Mhm.
So what, 1 or 2, I didn't see all things.
Yeah.
You know, everybody's struggling in their personal life with gasoline and food.
Right.
And it just seems like it must be overwhelming to some people to think about doing one more thing.
Yeah, you're right, Patty. Yeah, it can be very overwhelming. As far as today, this actual meeting, and folks, I will say there is a conflict of time because home court meets on Wednesdays. Our CPCs are on Wednesdays. So some of those housing providers are at home court, working with some of those clients. So that is a conflict of just scheduling. Yeah.
So part of it too, that, if I'm a county commissioner, I'm an elected official. I want to focus my efforts on things that I know are going to bear fruit, that I'm gonna be able to solve the problem. And I'm not gonna throw a bunch of resources at a problem and it's gonna grow by 40% year over year. So maybe the goal of this coordinated committee is to clear a path where they can follow to show them what paint a vision of a possible solution that feels doable.
I love that. I will tell you, you know, as you all, this room can imagine, I have walked into some communities and some parts of the state house where the assumption is that the politics that I'm going to say are not necessarily aligned to who I'm going to speak with. And that's happened often. I mean, we're in Ohio. But I would tell you that human beings, and especially those that are elected, want to be successful. People want to be successful. And the better your pathway into getting anyone that you're dealing with to success, to be celebrated, to say thank you, the better the relationship, the better the trust. And so I try to walk into spaces that are unkind to what I'm saying, because that's my work. I feel like I don't need to, the pastor doesn't need to talk to the choir. I need to talk to the folks that don't believe me. So, but how do you do that? Well, you set up the space that we can be successful together, and this is how I need you, and then this is how I'm going to show up. And it doesn't have to work all the time, but I will tell you that I've had success across the aisle in a bipartisan way. I've had folks, and I've said this, I have folks that have literally no politics that align to mine, give me the most support, give our communities the most money, and check in. Because what do people want? Well, they want to not hear the issues only, but figure out how to solve the problem. So that's the key. I think that is more key than you can imagine, which is why it's also important that we create, curate, and design a local response system that makes sense, so that when you go talk to anyone, you can set them up for success, because in reciprocity, it sets the community up for success.
Can we ask a few more questions? I don't know if you want to go into groups.
Do you guys want to go to groups, or is this work? Groups? This works.
What research has been done to identify the reason for affordable housing increase?
Oh, gosh. There's a lot of best practice work that shows the unaffordability of housing and why that has gone up. I'll give you 3 really quickly that are more Ohio than the rest of the country. This is for the whole country. We're all together in this. This is the word I've heard, the phrase I've heard, just so you'll know that in 2008, housing caught cancer. Okay. And it never recovered. Okay, all of us felt that. The second issue was the major factor that not only did it never recover, but then because of that, development of housing has gone down across the country. We just don't have the same number of developers, and to be very specific in Ohio, at least in Franklin County, we only have 3. When we see the most fruitful communities, they have at least 8 to 12 developers. We have 3 in Franklin County. Okay, so what that causes you, if you don't have diversity of developers, there is no cost incentive that pushes costs down. Then the third, which is what we're all experiencing, but you'll experience it a lot here in Ohio, is NIMBYism is the other driver.
It's what?
NIMBYism, not in my backyard.
Yeah.
I don't want density, concentration. I don't want extra. I don't want, and in general, I want you all to hear this. Boomer generation was the largest generation ever born. So big that you have a part 1 and a part 2. Boomer 1s and boomer 2s. Right. That also means that they are aging faster than larger than any generation, and that the housing that they are built is for them. Okay. Millennials are the largest generation next to boomers, and there's not enough housing, and there's not enough deeply affordable housing. There's not housing being built for them. It's just not enough, because those 2 big, very big generations on either side don't have enough housing for the aged. And so what ends up happening is those with class and wealth can build what they need. Others stay, and it doesn't allow for deeply affordable housing to turn over for this really big generation who's coming into their own. And so NIMBYism matters, because if it's not in my backyard, then we're not taking care of our young people. And that's just the truth. Those are the drivers. Research will show a lot of other things, but those are the 3 main. A lot we share across the country, and some are Ohio. Okay.
Yeah. How can I be a partner or collaborator as a shared living housing support?
I think anyone in the room has already decided to do that. Where I think that the next steps are that we need to have a coordinated action items of some goals that you all feel really good about, that you're walking out the door saying that these are the 2 or 3 things that we are going to do in this community. And those action items are concrete, that they're tangible, right? They're smart, right? They're measurable. You can see them, and they're happening. I think that the other thing here is that I've told Deb this 100 times. You all have talked about this enough. It's time to move. Right? It's time to move. You have to be actionable at this point, because you're already smart. You got it. Right? I would say that's. You want to know what's up to? This is your.
Yeah.
You want to move into groups?
Yeah, why don't you go ahead?
Oh, we're going to move into groups for the last. Want to do like 10 minutes?
Yeah.
This. Okay, what is it?
Did y'all say I just wanted to do it together? I think that's fine.
Yes, do it together? Yes, okay. Is that it? Is that all? Okay, are there any more questions? Any other thoughts? So then we can go ahead and then organize.
Okay.
Yeah. Any more thoughts, questions, concerns? Yeah, please. I think there should be some concerns in the room. Yeah, please.
Thank you.
And then. Whichever 2, you guys work it out. What are your concerns? Sure.
Not necessarily a concern. Well, I guess it is. So for all that you do, your organization, just briefly, how many people in your organization, how many people on your staff, and how many people are you serving right now?
Okay, the serving number is gonna be tougher. Do you guys know the serving number?
Last year we did, 20,000, a little over 20,000.
I'm gonna say 25,000. Did that include warming center?
I believe it was transitional housing.
Okay, with all the- okay.
Some of our units.
All right, so right now I have 39 employees, I think 39, 38. 38 employees. 38 employees. When I first came, I think there were about 27, so I've increased, the amount of employees, because just to be quite honest, in the 5 years prior to me, we increased from 35 million to about a 60, at the time, about $58 million organization, and people were just overworked and overwhelmed and felt like that there was just one more thing you always have to do. So increased employees to that, I think we need, our sweet spot would be around probably about 42 to 44, big county. I've already told you partner wise, I think that we need at least about 8 to 10 more partners, because there's just big gaps that we just not only aren't doing the work for, but the community isn't even holding us accountable to do that. I think the best communities are the communities that will say, what are you doing with this, this, and this? And there's a tight tension. I think that's good for communities. So, yeah, more partners. And we take care of, you said about 20,000 people. The variance in that is that, as you all know, as I'm sure in your community, as any nonprofit could tell you, you're probably doing some work that's off the books. That you just don't have anywhere to report it, because it's not really in a way that is structured that you get the dollars reported out, but you understand that it's connected and conflated with some other issues that must be taken care of. So for instance, when I walked into the community, we had one shelter that we said is our overflow. And the overflow shelter is a shelter that we use every single solitary day. On average, it has about 450 people in it. Van Buren, one of our 9 shelters, very large shelter. We found out that it was the largest shelter in the country. A mess. Isn't that terrible? The largest shelter in the country. In the winter, it goes up to about 850 people, 250 kids there all the time. And so when I came into the community, not only was I aghast that we had a shelter that had 850 people in it and was normalized, but then I had to figure out, how am I going to break that up? Because that was just, in my own personal sensibilities, was awful. Just awful. So how am I going to break that up? So the opportunity that I could see of how to break that up was in the winter. So in the winter, as Deb talked about, we didn't have these things called warming centers. In fact, what we did have, what we called them, were overflows, and that our current shelters, makes sense, right? Our current shelters, there'd be a couple of them that we would expand out, and so that people that were cold could come in. But the problem with that was that those that chose to be unsheltered weren't going into the shelter, even if it's cold. A couple reasons why. Some people had pets, and the pets weren't allowed in the shelter. Right. Okay, that makes sense to people, right? And no one decided to change that rule. How crazy is that, right? So that, the other part of it is that if you were a couple with no minor child, that you would get separated, because, you know, shelters aren't made for couples. Okay, so you get separated. If you were a couple that, in, you know, the eyes of male and female, but you were a couple nonetheless, then you weren't considered a family, right? So 2 men, 2 women. Well, that felt normal too, to our community. And I said, okay, what happens if there's a mom with a daughter? Like, if we just sexualized every single solitary couple? Yeah. So people wouldn't come in over that, because you get separated. What if there's an autistic child who's an adult, who's with their parent? What happens then? Oh, no, you get separated. Like, it just, these rules that don't make sense in homelessness. It doesn't make sense. So what we did was put some dollars together, and it became a $1.7 million enterprise, and a 1.9, and then it became a $2.2 million enterprise. We were going to have warming centers, and these warming centers were going to be north, south, east, and west. They were going to be within the centralized area of downtown, so people can get to them, transportation, things of that nature. And what we found, this is our third year of doing it. And what we have found is that not only do those people off the land will go to those places because they're not a shelter, but then they come enough for us to get them housed. house 54 people off the land. That doesn't sound like a big deal, but that's a big deal. They just skip the shelter altogether. That people can just get the resources that they need, however they need them, whatever way that they show up. Now, a $2 million enterprise, what does that have to do with Van Buren or this big institution? Is that those were, I think we had, oh gosh. I think we've, oh gosh, I hope I'm saying this number right. If not, I'll correct myself. I think we had 350 people move through warming centers in 4 months. And those are people that would have never, ever walked into our shelter. So I'm noting that because not only from a staff perspective, right? How many do you have? How much? But you also have to be very mindful that whatever strategy that you are pulling out, not only is it important for elected officials, but you got to have the resources. Because let me tell you the other thing, it's great, right? And it's a success. But the other struggle is that I've just added $2 more million to my overall budget. And it feels like, right? Did you do the right thing? Because 43% increase in adult homelessness. Yet the numbers show that not only are people coming, but they're getting housed. So that's some of being the tip of the spear, right? And being your own continuum of care. That's some of the challenges from a leadership to perspective, staff perspective, transition perspective that you have to consider. Sorry, I hope I answered your question because I feel like I lost it.
Yes, that was great.
Okay. Okay. Any other questions?
How do you address the fears of the nonprofits that they're losing control?
Repeat the question.
How do you address any fears that nonprofits may have that they're losing control if everything's centralized?
Yeah, couple things. I think it is okay to acknowledge people's feelings about things and they're valid because it's probably coming from an intuition or a sense that is needed for us to keep skepticism in the room. I keep saying that. It is important for you to question. It is important for you to not have a room that is so monolithic that everybody is agreeable. You shouldn't want that. It's not good. It's not healthy. Okay, so that needs to be. Skepticism is good for the room. Agreeable rooms are too monolithic. A lot of bad gets done in agreeable rooms. Truly, right? So that's, I'd say, good. Welcome. They should have a place. There should be grace. And then the next is that I would answer that you will lose that type of control that you can see so clearly. You will lose it. I think that's got to acknowledge what will be lost, and you need to have people articulate what will also be lost. And then how do we balance that? Because, this is work and this is business. How do we balance that what's to gain? Because if we're going to talk about in any relationship what is lost, you can't not talk about the other side of the coin. And then how do we then make an informed decision together with that? And the informed decision may make those that say we want it say, oh, I see what you're saying. Maybe the risk is too great. But having each side doesn't work. Likewise, I think my other point is going back to the first, I think it is okay to have rooms that are in disagreement without being disagreeable. Do you understand? It's okay. That's okay. I think I've told Deb that probably right. It's all right. We get our emotional energy all connected as if we're talking about the character of who we are, when in essence, we're just trying to solve for homelessness. I say this to my staff, the thing that gets me down the most in doing the work is I'll say, in conversations, I feel like I'm talking about everything but homelessness. And I'll have to remind myself, okay, Shannon, you're solving for homelessness. And I think That's what you have to do in the room. What is the grounding? What is the center? What is the safe word? What are the things that is going to help everyone have dignity while you move through an emotional conversation that also includes change management? And then just very tactically, do you all need someone to facilitate it? Right? You just need someone to help get through that. I will tell you, though, that the minute I'm telling you this because I've seen it 100 times, that you all become a collective response is the minute you'll have more resources. It just happens that way, even in business. It just happens that way. But I think it's okay to say to people, you're scared, I get it. You have fear, I get it, and I know why. That's all right. And not talk them out of it. Now, for those who have it, I would say, as I think you should do, as I walk into work at times, if you're scared and you're fearful, you do it anyway. You can feel and work at the same time. Women, you all know you all can do a lot of things at the same time. So.
You know what, I feel like I have to come up here.
Okay.
I am long retired. I'll be 87 next Monday. Yes, thank God.
Thank God.
But my heart breaks for Deb and United Way because they work so hard. And it's gone on and on and on, and others in this community and making changes.
He's fine.
You want to move to Licking County?
Happily. Happily. Happily, thank you. I think that as we're winding down, you know, there's many of you that I've seen several times in the room. And I want to thank you. You know, it is not easy, even if you get paid to do it, to spend time on things that probably in your lifetime will never be solved. It is, for some of you who are on the front line, there's social and emotional work that I know for some of the nonprofits, not only do they take home, but they take home to people that aren't even in the work, but have to hear the work. And those are community lifts. So I want to thank you always, Deb, for inviting me, for being such a gracious community to listen and to wrestle with this. To wrestle, I know I haven't, wrestle together. Yeah, wrestling together with this. So I thank you for the time that we have together. And we'll move into action. I'll work on our communication that I hope will go out to this body, and we'll start organizing what next steps are. All right, thank you.
So I want to thank Shannon. Thank you all for being here. Again, this is timeframes, the same time frame, unfortunately, that the home court is taking place. So probably have some of our partners who are there at this very time. United Way is going to move forward. What I will tell you is we're not going to solve this issue perfectly in my lifetime. I keep coming back to a book that I read a couple of years ago. It's called Long Path by Ari Wallach. And he keeps encouraging us to become the ancestors today that our future generations need us to be. How can we keep in the distant future our goal of doing a better job of helping those who are struggling with housing insecurity? What can we do today that will ensure that it's better in the future than it is today? How can I put aside my own individual hopes and dreams or the success of one program or one project or one staff person or one issue for the greater common good for the future? And we have all, need to wrestle with that question individually. We fight for those things we want to hold on to the tightest. None of us are taking a U-Haul being pulled behind our hearse with us. It's not about what we are taking with us. It's about what we are leaving behind. So please get involved. and ask what you can do to help leave this community in a better position to address this issue collectively. When most of us, I don't see a ton of Gen Z people in here, but most of us will be gone at some point. Please get involved. It will not be the perfect solution tomorrow, but we're gonna go ahead and put together a response system and invite and encourage people to come wherever they are in their understanding of that and to be a part of this. So I want to thank everybody. I want to thank especially Shannon for being patient. She's been a great mentor, a great sounding board. Their whole organization has worked with us, and I just can't thank them enough. So let's get that. And stay tuned. We'll see you next month at our next CPC forum, which is
Food desert, addressing food here.
food deserts. And let's all keep in mind, SNAP changes go into effect June 1, so. All right.
Not enough.